Okay. Hello there. My name is Joyce, a Strunk of Premier Group, the CPA firm in Lanham, Maryland, and we are joined today by Nurse Practitioner Nerissa Nuberry, who actually just worked a double shift. So we are not going to keep her long, but I wanted to at least check in with her and see what types of things that we need to be thinking about since there are changes on the horizon and we're seeing these different phases of reopening. So thank you again, Nerissa, for all that you do, and thank you for your service. How are you today?
Thank you. Doing well.
Good. So I understand that are we going into phase 2 of reopening tomorrow, June 19th?
We are.
Okay.
We are.
And so what should we be thinking about? Because I was out and about last weekend and I saw people acting like everything was good and we were back to normal. There were no masks, no nothing.
Yeah. So the big thing is for people to realize and understand that the virus is still on the horizon. It hasn't left. It's not quieting down. Despite what you're seeing, it is important to be mindful of wearing your mask, still doing social distancing, wiping down your surfaces, especially if you're the person that's going back into the office where you might have been working from home or maybe working at less capacity in an office setting. You are essentially more exposed as more people are coming into the office. So the virus is still in effect. Take, for instance, in Florida right now, they're looking at possibly closing down certain areas because people are going out, they're doing happy hours, and just really being irresponsible.
So what is it about us that makes us, is it just the fact that we were quarantined so long that makes us want to almost forget about the virus and just,
Absolutely.
Okay, I'm back to normal, everything's okay?
Absolutely. And I think a lot of it has to do with, states are starting to reopen certain things. So people essentially are thinking, it's reopening. So that means I could be a little bit more lax, but this is actually the time to still be vigilant about doing the things that you need to do from a health standpoint.
So I saw that when things reopen, at least in Maryland, in phase 2, that means the indoor like entertainment centers are going to be open. I'm assuming that's like Chuck E. Cheese's, and I've always thought Chuck E. Cheese was a breeding ground for germs. And so what should people be mindful of when they're going out to like a Chuck E. Cheese or indoor sports park? How should they kind of maintain, even for themselves and for their children?
Yeah, so what these facilities are supposed to be doing, they should be doing it at 50% capacity.
Okay.
Essentially, I'm not sure how they're managing that because it would be, someone has to be paying attention to who's coming in, how long they're staying, cleaning, wiping down surfaces. If you must go, making sure that you're exercising, hand washing. If you have young children, I have a 4-year-old and I wouldn't take her to our indoor area right now, just because at 4 you really don't understand. They still touch things.
Right.
Sometimes it ends up in their mouths. So that's something I would do, maybe a park.
Okay.
An outdoor park, somewhere where you're able to practice social distancing without really thinking about it too much.
So when you go to a park though, are you taking hand sanitizer and working down like the monkey bars, or are you kind of like, I said, this open air and the city or the state should be managing that?
They should be managing it, but I don't know that they're doing that. So I wouldn't say wiping down monkey bars. I would definitely say making sure that your child washes their hands or at least sanitize their hands afterwards until you get to a place where you're able to wash your hands, because that might be a little challenging to do. If you may not have enough wipes, it can be a little challenging to do that.
Okay.
So this is the time that I would wear, don't wear shorts out. I know it's a little bit, for younger kids, maybe doing something like capri tights, where most of your skin is covered. You still wear a t-shirt, but try not to be too exposed, especially if you're going to an open outdoor playground.
Actually, that's good advice for children and for adults, because I think we're so used to, even I think the hand thing, not touching your face, that was a really big deal, and it still is for most people because it's just out of our normal character. And so not leaving yourself exposed is important, right? Especially right now.
Exactly.
So with that being said, there is one other question that's been a burning question, at least for me. I've seen different guidance on children wearing masks or not. Some people say children don't need masks. Some people say everyone needs a mask. Where do you land on that topic?
The children absolutely do wear masks. So
Okay.
even for myself, I take my daughter out. We live in a community, you know, we're able to walk. We live right
Mhm.
next to the walking trail. And I still put her mask on just because you never know who you will come in contact with. And you're more than likely, we are going to pass people who are going to be less than 6 feet. So just to prevent that, we're walking. I'm still vigilant about looking at the surrounding, but I definitely, whenever I take her out for a walk, riding her bike, she has a mask on.
Perfect. No, that's helpful. And
Because
then,
they're not exempt. They're still breathing the same air, you know, and it's really just protecting them.
no, that makes sense. So it's better to be safe, I guess, than sorry is what they're saying. So are in Maryland, are we
Absolutely.
seeing the number of cases decline? Are we at a plateau? Where are we kind of at?
So the numbers are somewhat declining, but PG and Montgomery County are still, you know, they're declining slightly. Even in PG right now, we still have we're averaging anywhere from about 7 deaths a day, which
Wow.
it adds up. So it's still a lot. It's
All
better, of
from
course,
COVID?
than where we started.
Still from
Yeah.
COVID or other stuff? Just COVID deaths.
COVID underlying.
Wow. That's
So although it's less, it's still, you know, a decent amount of people that are still dying essentially. So that's something that I always say that people essentially should pay attention to, because again, although we're reopening, it doesn't mean that the virus has gone away. It absolutely does not mean that.
And I think even the news media, if you watch the news, we're kind of turning the corner. I feel like it feels like we've been so overloaded with it that they're not even talking about the numbers of deaths now. It's almost like they're trying to slowly push you back into, like, it's okay. They're giving you the all clear, but it's not. And you do need to make sure that you're still being careful every place you go. So we appreciate your advice. And
Absolutely.
thank you for taking the time to talk to us. And we look forward to talking to you again soon. And if you need additional assistance or if you have questions, please email us at accounting@pgservices Inc. and we can put you in contact with Nurse Nerissa for future questions. Thank you and have a great day.
All righty. Thank you.